Dr. Ian Rassel here from Corrective Spinal Care of California. Welcome. This video is all about low back lumbar discs. We're going to be talking and sharing with you how you can determine whether you have a disc bulge, if you have a disc herniation, or maybe this is just muscular. So it's important to start with a model, and this is a plastic model. This isn't real. Okay, this is a plastic model, and what it shows is this is a normal bone, and it should look like that in the lower back. And when we look at the disc is an incredible structure because it acts like a cushion. And you think of these cushions, the outside is the strongest material in the human body. This is fibrocartilage. We have fibrocartilage in our spine and our discs. We have them in our knees. We also have them in our jaw, our TMJ. So the fibrocartilage is on the outside. The inside is this jelly-like substance called the nucleus pulposus. And this combination of two materials allows the spine to move and keeps the bones protecting the gentle and delicate nervous system. Now with bad mechanics, when these bones get out of place, what we call a subluxation, these bones eventually start to rub the outside portion of the disc. And it's years and years and years of bad mechanics in the spine and that rubbing till eventually we start to rub that outside so much that that inner jelly starts to push out. Now this is what we call a disc bulge. Now the difference between a disc bulge and a disc herniation is if this bulge, which can push on the nerves, it will give you a sensation of pain. This is going to be a deep, aching pain. If this continues, which unfortunately in America this happens a lot because what we do, we just put more medications on it. We take some anti-inflammatories, we keep doing what we're doing, we never get to the root of the problem. We don't fix the mechanics of it, we just cover it with symptoms. Well, eventually the bone continues to rub on that outside of the disc. That jelly that was just starting to come out, what we call a bulge, will eventually turn into a herniation. Now, a herniation is definitely different from a bulge. When you have a disc herniation, you're going to have sharp, searing pain down into the buttock, down into your leg. Eventually can cause what's called sciatica or sciatic neuropathy. Once we have a disc herniation, it is crucial to get the bone in a better and safer place in your spine. We have to, over time, correct this problem because otherwise it will continue to wear down. That jelly-like substance is going to leak out and eventually that herniation can float into the spinal canal and cause all sorts of problems. Now in America, usually before any of this happens, we've taken drug after drug and eventually that stops working. So we go get a shot, a corticosteroid shot. The steroids alleviate the pain. Eventually it comes back again, and now it's worse. And eventually we're set up for spinal surgery, either a discectomy or a laminectomy. So at Corrective Spinal Care of California, getting to the root of the problem early on is going to give us the best results. This is why you're going to see so many kids and teenagers in our clinic. You know, they're busy playing volleyball and jiu-jitsu and swimming, and rather than waiting 25 years before they're signed up for surgery, moms and dads bring them in at an early age. Now most of us don't know about chiropractic until it's too late. So if you or someone you know is suffering from possible disc bulge or disc herniation, please reach out to us. Please like this video. Please share it with someone you care about, and you can also call the office and we can get to the root of your problem. Hope this helps. We'll see you soon.